I am Dr. Swarupa Mitra, radiation oncologist. Let me talk to you about the side effects expected during radiation to the breast. Most patients of breast carcinoma do need to undergo radiation therapy, especially those patients who have their breast conserved. They have to undergo radiation therapy in most of the circumstances. The side effects of radiation, or per se anything, any chemotherapy or any treatment, has side effects, and they are mostly for a short period of time. Why do we get side effects? Because when we deliver radiation, they are all targeted. They are only to the area at risk. But yes, some doses of radiation do reach the normal tissues around, causing some inflammation, and that gives us the side effects. And these are very temporary. As soon as the skin and the other organs start healing, so they are all cured. The side effects which are very expected is the darkening of the area where you are getting radiation. That means the breast, if the breast has been removed, the chest wall, the axilla, that is the underarms, both sides, the undersurface of the breast of the opposite side, the neck. So these are the areas which do get the browning of the skin. So you might think that I am being treated for my right side of the breast, right breast. So why am I getting on the left side? So this is because of the beams which are exiting the opposite way. So they cause some darkening of the skin on the opposite side. The other side effects which you can expect is that difficulty in swallowing. Sometimes when the lymph nodes in the supraclav, that is in the neck, they are radiated, then some bit of radiation does cause inflammation of the food pipe, and that gives you some difficulty in swallowing around midweek of the treatment. So this is also very temporary, and you are given some conservative treatment like some antacids which help you to take the food, and they are again temporary and they are healed. Other than this, you may have, especially those breast cancer patients who have received chemotherapy, they are likely to get the blood counts decrease, that is a falling blood counts. It's generally the white blood cells, that is the white blood, or the platelets. So they may decrease during radiation. So your doctor might tell you to get the blood test done once or twice a week, depending on how your blood counts behave during the treatment. So these are absolutely expected. If they happen to you, you don't need to be threatened at all. You don't need to fear at all. Other than this, most of the side effects are very mild. You may have some loss of appetite, loss, fatigue, not feeling like doing anything, not feeling like eating anything. So, but these are some weakness. So these are all expected and a part of the treatment. You don't need to get scared or worried at all. During the treatment, so that you can allay these side effects or they are diagnosed early, be prepared to meet your doctor once a week at least. Otherwise, if he says that you meet him twice a week, please follow his advice. So during the follow-up, during the treatment every week, what the doctor sees is your skin reactions, your blood counts, and your general condition to see if you are faring the treatment well. So that way he sees you, evaluates you, and then decides whether you need some medicine needs to be added or not, or some special instruction needs to be given or not. So it's very important during the treatment you must have good food, preferably homemade food, lot of fluid. You may have chicken, fish, and mutton generally we avoid, but eggs you can have. If you are a non-veg, have a balanced diet of proteins, fat, and carbohydrates. Similarly for veg patients as well. Do not forget to include some stress relieving exercises, maybe just a walking, maybe talking to a friend, or maybe following some of your hobbies. So they really help you to focus on your treatment, keep you very positive, and also they leave you stressless. So these are all about breast radiation. Yes, before I conclude, wear cotton clothes, very loose cotton garments, and generally you are advised to not to wear your undergarments during the treatment. So please follow the advice if you have been advised by your doctor. So I'm sure you are ready to undergo the breast radiation, and I'm sure I can assure you after a month of your treatment, you will get back your normal skin and your normal level of energy. So all the best to everyone who are receiving radiation. Thank you.